The internet changed how we work. AI is changing what work gets done. A bank cut loan processing from days to hours. A student built an AI scheduler, improving on-time delivery from under 70% to over 90%. Most teams know AI matters, but aren't sure where to start. InAI is Indiana's statewide AI adoption effort, built with industry, academia, and community partners, helping you move from understanding to action. Visit inaiready.com.
This is the IBJ podcast for the week of August 17th, 2026, brought to you by Taft. I'm your host, Mason King. Welcome back to the podcast, everybody. On July 27th, public officials in West Lafayette joined local business leaders and executives from the Fort Wayne-based Parkview Health System to break ground on the site of a planned $200 million hospital and medical office building complex expected to create 250 healthcare jobs. The Lafayette-West Lafayette area already is served by two hospitals in the IU Health and Franciscan Health systems, but the leaders assembled said the area's growth made clear the need for the new facility. Meanwhile, Parkview has been working through an agreement with Lebanon-based Witham Health Services, which provides medical services to residents throughout Boone County, to join Parkview later this year. That would bring Witham's hospital under Parkview's purview, as well as several clinics across the area. Parkview is also building a freestanding emergency department and urgent care facility in Marion. And Parkview and Noblesville-based Riverview Health are nearly a year into a managed services agreement aimed at getting the struggling county-owned hospital system's finances in order. Parkview started growing outside of the Fort Wayne area in 1995 and now counts more than a dozen hospitals, medical centers, and health institutes across northern Indiana and northwest Ohio. And it's looking to continue to expand. In this week's podcast, Dr. Greg Johnson and John Bowen, two Parkview executives leading the system's growth, discuss the push into central Indiana and what makes it attractive for expansion. They also cover how they determine demand for another market player, what they think differentiates Parkview from other systems, and how they plan to staff the West Lafayette Hospital. Here's our conversation. It's my pleasure to welcome to the podcast Dr. Greg Johnson, Chief Physician Executive of Growth Markets for Parkview Health. Greg, thanks for making time to come down to the studio.
Thank you.
And we also have with us John Bowen, Chief Growth Markets Officer for Parkview Health. John, welcome to the studio.
Thank you. Glad to be joining you.
So a note for the listeners, as I told Greg and John before we started taping, I am not a healthcare expert. I'm coming at this topic a little more from a consumer angle and as somebody interested in how the business of healthcare works, not so much as an industry analyst. So I'll have some high-level questions about the growth of Parkview before we dial into some of the details of entering the central Indiana market. So the two of you together lead Parkview's Growth and Emerging Markets Division.
Yes, sir.
Is that correct?
Yes, sir.
That's correct.
Great. These are the right guys. Growth is in both of your titles. I think sometimes in the business media, we tend to assume growth is good inherently. Explain to me why a healthcare system that's already well established in northern Indiana and northwest Ohio wants to expand to central Indiana.
Yeah, so I'll start. And I would say that one of the driving forces has to do with scalability. So a lot of the back office functions that are required by health systems and healthcare providers, it can be done at a better cost per unit when you have more units, because you can get that scalability from things like revenue cycle, supply chain, even purchase services. So that's one of the driving factors.
So when you're talking about back office, those are some examples.
Yes, sir.
Of things that,
Right.
The administrative things that are necessary for running a healthcare system.
Yes.
Yeah.
Yeah. In fact, if I may, a little bit of sidebar, when we talk to our frontline coworkers, like a nurse or a physician, when we talk about growth, they're kind of like, well, wait a minute, I'm busy enough, right? And we're not talking about putting more on our frontline workers. This is really about expansion of our markets. And we look at our Northeast Indiana and Northwest Ohio presence as kind of our, what we would call our core market. And anything outside of that is considered our growth market. And there's a lot of obviously activity in greater Indianapolis area. One of the reasons we're here. John, would you want to add?
I think that's spot on. When we look at growth and the why, there's the economic that Dr. Johnson did a great job of explaining, and we're always thinking about how can we support our front lines and not overburden them, as Dr. Johnson alluded to, but also create that scalability and reduce some of that back office. And so growth really presents a great opportunity there. The other thing is there's needs across the state, across multiple states. We think that at Parkview, we're pretty proud of our culture. We're proud of our physicians, our nurses, our techs, our staff. We think, well, we know they do a great job. And so as we've identified needs in multiple regions, and those regions have reached out to us, we think there's an opportunity for us to serve out our mission while meeting those needs.
When you say the regions have reached out to us, who is that? How do they do that?
I'd say anywhere that you see us right now. And so we've had, how many years, Greg? 3 years, 4 years that we've had conversations in West Lafayette. We've had multiple years of conversations with folks here in central Indiana. And so identifying the need it's kind of easy. That's the easy part of the process. It's how do you meet that need and go through planning and figure out how you go about executing the plan. And so that's what you're beginning to see in a lot of these different communities.
And if I may, I would say that another way of putting it is you can identify the need, but there also needs to be a desire for the community leaders, local politicians, employers to desire Parkview to come into the market. So there's needs, but we combine the two. And I would say a great example of that would be a recent example is Warsaw, Indiana. Warsaw, Indiana had been asking for a Parkview presence for many years. And then when the need matched the desire, that's where we expanded into Warsaw, Indiana. That's a good example.
So if we just look at the West Lafayette area, I mean, how do we identify that need, or not necessarily identify it, but how do we describe that need? Who needs what Parkview has to offer?
Well, I would say that West Lafayette is in, I don't want to use the word desperate need, but they are definitely in need of increasing medical services. Clinical medical services are really an infrastructure for businesses. It's not much different than energy, et cetera, that you need to bring businesses to the local economy. And West Lafayette is growing. The providers that are in that region are good providers, but there is definitely a need for more clinical services now and definitely projected into the future. John?
It's really, the rate of growth that we're seeing in West Lafayette is really remarkable. And it's not just in West Lafayette. You have that whole region. If you move west and north of that area, it can be 30 minutes to the nearest hospital. And as that population is growing, that need is beginning to become even greater. And so that's something that we noticed. The community definitely expressed it. And so we shared our vision of how we felt like we could go about meeting those needs to expand that access. And really, as Dr. Johnson shared, partnering with those business leaders to make sure that we're doing it in a way that supports their vision as well, because it's such a great area of economic growth. We want to be an engine that helps support that. And so that's how we worked to come to where we are today.
Okay. So I don't know so much about hospitals, but sometimes we see businesses that provide a service to consumers can get spread too thin when they expand too fast. Like they have trouble finding the employees that they need. They have trouble maintaining the operational values of the company. How do you keep that from happening?
So I would start with, I think with Parkview's culture, there is a desire for healthcare workers to work under that type of culture. Again, I use the term physician-led, and it's not it's not just a jargon that we're physician-led. It's in actuality, as we talked about, where we work in dyads. John and I are partnered as a dyad in the growth markets. You can say every executive has a physician paired with them, or you could say every physician has an executive paired with them. Physician leader. It's a true partnership. And so I think there's a desire for that type of culture for providers, nurses, physicians, nurse practitioners, therapists. I can go down the line. There's a desire in healthcare for providers to be functioning under that type of culture.
I love the question that you're asking around culture. I think it's one that we don't get asked often enough, and it's one that I love talking about. The culture of Parkview is truly special. It starts, I think, with some of the things Dr. Johnson spoke to of being a physician-led organization. We listen to our physicians. Physicians really help set that strategy, and we work together. It's a true partnership. But even going layer deeper, looking at just clinically and our nurses, our staff, our techs, it is truly a special place to work. It has a family feel. We talk a lot about culture and who we are. Our retention rate is 90%. In some departments, it's well beyond 90%. What was it for nursing?
92.
92, which is remarkable. You're doing great if you're at 85% retention. We're at 92%. And so that speaks to the culture of who we are and how we value people. And so as we grow, our focus really is on meeting the needs of the community and expanding that culture of focusing on people. And so as we go into a West Lafayette, or you see us go into Marion or wherever else, that's our focus. Our focus is on the people.
But as you get bigger, does it become harder to make sure that you're replicating the culture everywhere you are?
I don't think so at this point, to be honest with you. If it would be a challenge if you had, if it wasn't a focus, if it wasn't a topic that we're very intentional about. I feel like it's as much a topic that we have that we are very intentional about cultivating and expanding on as anything else around. We call it the diamond, but anything else.
Yeah, I would add that besides intentionality is authentic. And so when it's an authentic culture, you ask a great question, as John said, about culture. Is it automatic? Absolutely not. And it has to do with how you hire, who you hire, what are the characteristics you're looking for in the people that are joining the Parkview family, joining the team. But I think it's that authenticity that helps bring that and carry it. Is it something that we that's high on our list to pay attention to? Absolutely.
I'm going to assume that most consumers are like me, and they think, well, one health system's big hospital is essentially the same as the other big health system's big hospital. So when you go into a market, how do you differentiate yourself?
So I'll jump in on that one. So first off, Parkview is well established from a safety and quality perspective. I won't run through the various accolades and ratings that we get, but they are exceptional. They're best in the state. The second, though, which is probably as important, is the service excellence piece. And by service excellence is how are not just patients, but how are the families treated? How are they listened to? And it's interesting. We use the term listening a lot. We listen to our doctors. When we come into the communities, one of the things that they've been very receptive to is we don't come in and say, you need to do it this way. It's a partnership when you come into a community, and I'm not suggesting other health systems are arrogant or stuff, but we want to put that aside and listen, because we don't know everything, especially when you're coming into a new community. You don't know the culture of that community per se. So I would say service, safety and quality, that's foundational. Service excellence, access. And that's one of the reasons many of the communities ask us to come in, because of access issues.
I think, to go back to your question, a lot of folks, when you think about a hospital as a hospital. And one of the things you're seeing industry-wide across the nation is economic pressures begin to set in healthcare for health systems, there's this consolidation of services. And so it's asking patients, we want you to drive an hour or an hour and a half to come see a fill-in-the-blank specialty. One of the things that we're very focused on is trying to create access points for folks closer to home. Because if you have to drive 15 minutes versus an hour for services, you're going to be a lot more compliant about receiving care. And that naturally affects outcomes. And so that's something we spend a lot of time thinking about as well, is how do we get the right amount of access close to home for as many people as we can.
Okay. Let me recap from how I understand it, that some of your activity in central Indiana, because I think you mentioned Marion too. So I just want to make sure these are fresh in my mind. So Parkview is growing very quickly in central Indiana. So you have a hospital under construction. I think groundbreaking was on my birthday. I think it's July 27th.
Happy birthday.
Thank you very much. In West Lafayette. Lebanon-based Witham Health Services is joining Parkview Health later this year.
Yes, we're in the process of the due diligence. The plan is for them to join the Parkview family at the end of the year.
Okay. There's a freestanding emergency department and urgent care facility under construction in Marion. That's
correct.
If I may add to that, it's also an MOB, and we have an ASC presence in Marion.
What is an MOB?
Grant County. I'm sorry, a medical office building. So you'll be able to deliver those outpatient services that I had just referred to.
Gotcha. And Parkview has a managed services agreement with Noblesville-based Riverview Health.
Correct.
Okay. We are going to we're going to return to those and talk about them in a little more detail in a second. But I want to stay on growth a little bit more. Do you have any plans to open facilities or merge with any existing health systems any closer to the core of the Indianapolis market than the ones that we've just talked about?
I would say that the ones that we discuss are the ones that we can discuss.
Okay. Gotcha. So is it fair to say you're evaluating Indy metro market, the
Yes, sir.
county market?
Yes, sir.
For potential.
It's fair that we're always looking at where are there opportunities and for us to see growth. Where does it make sense? Where is there a need, and how do we engage in that need? But
Yeah, and I should say that it's not confined to Indiana.
that's a very
So John and I,
point.
our vehicles are in other neighboring states often.
Mm-hmm. Gotcha. So do you see any room in the Indianapolis area for a new health system or operator?
Yes.
I do. Yeah.
Okay. Anything in particular?
I would say access, service excellence, quality, safety, all those things drive for an added need in the greater Indianapolis area.
I'm a little fuzzy on how you develop a customer base when you open a new hospital in a new market. It's not like you're a pizzeria and everyone goes, "Oh, wow, there's a new pizzeria over there. I'm just going to go check it out." I assume that the part of the equation is becoming an in-network facility for insurance. And this is a total guess on my part. Am I onto something here? Is that some sort of an agreement that you need to have with insurers that you will be?
It's a crucial part of the as you start to enter a market, is partnering with payers, partnering with very important the employers in the community. Greg?
Yeah, so I would say, yes, you being in network is a crucial part of coming into a market, but I would also say direct to employer programs are really where what I think there is. John's going to laugh at me. The cat's meow. And when I say that is if you know, one of our primary goals is to keep our regional and statewide businesses competitive. And if we can keep their healthcare costs down, we can allow them to be more competitive on a national and international stage.
Mm-hmm.
And so the direct to employer is not just intriguing, it actually does that. It also allows you to meet the needs of that specific employer, because not all sectors of employment are the same. You know, you may have a business that is a very sedentary business, and it may be a very tenured business. It's different than a very, active business with a lot of physical activity with younger. So you really need to, again, listen and partner with those local and regional employers to bring products to them and services to them that allow them to be more successful. And when we talk about keeping their healthcare costs down, one of the hidden healthcare costs is when somebody's not working. And so presenteeism and absenteeism play a crucial role. So if we can get somebody, if we can keep them from missing work, that's ideal. But if we can get them back to work and maintain, functionality at work, that to me, employers are asking for that.
Greg's hitting on something that's so important. A lot of times when you have a hospital, it's the big building. It's the one that folks see, but that's where maybe 2% of the healthcare activity is really taking place. It's in the clinic. It's in the medical office building. It's in the schools where folks, we want to keep them healthy, keep them active so that you avoid that acute episode. And so as we think about that, that's where, again, listening to community leaders, business leaders, understand those pain points and how we can engage by going out into the community, keep folks healthy, accessing healthcare the right way. That's how we keep the healthcare costs, and that's how we really be a good community partner.
Let's take a quick break to hear from our sponsor. This is the IBJ Podcast.
Taft, today's modern law firm. At Taft, we cultivate a highly respectful, transparent workplace that fosters creativity, teamwork, inclusion, and diversity. We couple our culture with a client-first approach, rewarding lawyers who understand their clients' goals and work to deliver success. Taft, the modern law firm. To learn more, visit taftlaw.com.
Building a home or looking to upgrade what you already have? That's where Indie Grills comes in. From fireplaces, outdoor kitchens, to entire custom patios, we bring everything together to create spaces designed for how you actually live. We work directly with homeowners and partner with custom home builders to get it right from the very start. Are you looking for inspiration? Our massive showroom on the Zionsville-Lebanon border was built to help you see what's possible. So when you're ready to elevate your space, head to indiegrills.com and connect with our team.
All right, we're back with this week's episode of the IBJ Podcast. In my interview with Dr. Greg Johnson and John Boland of Parkview Health, as they dial down into the details of its plans for West Lafayette, Boone County, and Marion.
Let's take a look at the hospital in West Lafayette. Okay, and then get some more detail on that. I know that we called it a $200 million project. It is being developed on land acquired from the Purdue Research Foundation. Tell me more about the basic parameters of that project.
Our goal was first to have a vision of, as we listened to the community, they want a full service hospital. And so
What is full service? And does that mean maternity care?
Yes.
Okay.
Now, I will say in full disclosure that the day we open, we will not be providing maternity care, but the family birthing units are shelled, and that will be the second phase. And generally speaking, our second phase starts as the first patient's being admitted to the hospital. But it's going to be shelled, and so it's not like another building program that's going to go on. And we're planning on that. So the answer is yes.
When you say shelled, so like
it's under the roof
building,
but it's not finished.
Yeah,
it's an unfinished part of the hospital on the inside, and so
got it.
A full service hospital, starting out day one, is you're going to have full emergency care with trauma rooms. Not a level 1 trauma center, but you have the trauma rooms, comprehensive heart services, surgical services. You want, for the vast majority of things, that a patient will come in and they're having an acute episode, you're able to keep the patient there, not have to ship them down the street, but they receive care there in the hospital for the vast majority of things. And so that's the goal is to have those types of services. We also do have a phase plan is, as Greg talked about, we will start with 40 beds. You're hiring a few hundred people. And so we want to make sure when we do it right. Greg was part of the team that opened Parkview Regional Medical Center. I was president whenever we built the South Tower. We both experienced the same thing. The minute you finish a floor, you start building out the next floor. We anticipate it's going to be very likely going to be a similar scenario in West Lafayette. We've planned for that. We've planned that we're going to open with 40 to 50 beds, but we've built the building in a way that we can add on immediately. And so you don't miss a beat. And so as the need presents itself, we have plans in place to either expand capacity or expand services as we identify the opportunity and need there.
Okay. When is it supposed to open, at least the first phase?
Summer of 28.
28. Okay, great. Is that the part that will be 200,000 square feet, or is that including later phases?
That's the first phase of the hospital.
First part. Okay. And you said a couple hundred employees. How do you staff the hospital? Where do these people come from?
So we hired a chief nursing officer about a month ago.
You can give her a shout out.
Renee Smith is incredible. Physician leadership is so crucial. Nursing and clinical leadership is right there. It is so important. And so as Greg and I were talking about what are the needs that we have in West Lafayette, the first thing we knew we needed was a clinical leader who could make sure that we're hiring the right folks, have a good plan for when we open. So we're delivering that top-notch quality care that meets our expectations day one, but also can inform the design of the facility. I think so often health systems, we come in, we design it, and then after it's built or design and construction starts, then you bring the clinical teams in and you say, hey, is this set up the way that it needs to be? We're going to design this a little different. We've got clinical teams who are helping design the building so that for our nurses, our radiology techs, for each of our clinical teams, they have a voice into the design. So we have clinical experts who are helping design every part of this hospital. So it's a great place to work. And so the plan is work with the local schools, work with folks from where we have relationships with, so that we have a clear stage staffing plan, so that day one we're ready to go. And the thing I love about Renee is we've said, hey, once that final date is set, that's the day we're opening. And that's what we've done very well historically with PRMC, with South Tower, with several other projects. It's one I have no doubt we're going to be able to do again.
So it looks like in the Lafayette and West Lafayette area, there are a couple of other hospitals. There's an IU Health facility, and there's a Franciscan facility. So you've already determined there's room for another player, obviously, in the system.
We believe there is.
Okay.
Absolutely.
So do you recruit employees from these other hospitals, or do you bring them in from outside of the Lafayette area?
I don't think you have one tactic or strategy when it comes to hiring and staffing the hospital. I think it'll be a combination of, new grads, grads. You don't want to staff a hospital with all new grads. You want some wisdom and some experience. So it'll be I'll say a variety of ways that we recruit to staff.
Mm-hmm.
Giving healthcare providers an opportunity for a different culture, a different experience, I think is a differentiator for us.
Mm-hmm.
That's exactly right. It's never kind of a single strategy. It's a patchwork of multiple avenues. And one you didn't mention is our own coworkers. We got a lot of Purdue fans, so I know there's going to be some Boilermakers who are going to make the trek over to West Lafayette, who've expressed interest. And so it really is going to be several different avenues for how we get to opening.
And if I could add, one of the things when Parkview comes into a community, we want to strengthen the healthcare ecosystem. We are not looking to weaken a health system. We want to strengthen the healthcare ecosystem. And so, working with the other health systems and hospitals in central Indiana, we welcome that. we welcome working with them. It is, again, the best way to say is that we want to come to a community not to harm another health system. We want to build on the healthcare ecosystem to deliver the highest quality care to that community.
Gotcha. Is this hospital going to have a name besides something like Parkview Health West Lafayette?
I like that name.
I do too.
Parkview, I believe Parkview Hospital West Lafayette is the name that we have at this point.
Okay. Right.
I think that's a great name.
I do too.
It sounds just like what it is. That to me always is a good idea. So tell me about what is planned for the Lebanon market. I know that in 2025, Parkview had announced that it would build a hospital, $150 million hospital in Lebanon, but that is not the plan right now. What happened there and what should we expect?
So we are in the process of working through the due diligence with Witham, which has been, I'll say, a pleasure. Working with their CEO, Kelly, has been just a very, very rewarding experience. And again, we want to coming back to what I just said, we want to come into the community and elevate the healthcare ecosystem. I believe, I can't speak for Witham, but I believe that they think that them joining the Parkview family will accomplish that. We obviously think that we can accomplish that because putting the de novo build on hold. And I think we will be able to expand services in Lebanon and in Boone County. And again, a county that is growing rapidly. I believe that we would be foolish not to expect the need to grow services. The community leaders there and local politicians, I'm not taking sides or anything, but I think they've done an incredible job when it comes to infrastructure to bring these companies to Boone County. And healthcare, as I said earlier in the podcast, is healthcare is one of those needs, infrastructure needs to develop these businesses and to bring businesses into the county. So I hope that answers your question. We're exceedingly excited for Witham to join the Parkview family.
So the existing hospital, I think it was a 60-bed acute care hospital.
That's close.
Okay. So that campus will become a Parkview Health campus
as we move through due diligence.
Right. As you
once affiliation process runs its course, that's what we anticipate.
I'm so far out of my expertise right now. It's not even funny. I saw it described as a county. Is it county-owned hospital or a county-run hospital? Would it continue to be that, or would it be something different?
It would change as an affiliate of Parkview, just like many of the Parkview hospitals within the system. And so we've worked with the county on what that would look like. One of the things that's really important within Parkview is from a governance perspective, we maintain boards with our facilities.
Local governance.
We maintain a lot of that local governance while we also have a system board. And so a lot of that will continue to be in place, but the ownership will shift.
And an example of that is Logansport. So Logansport was a county hospital before it joined the Parkview family.
Oh, is that right? Okay.
Yes.
I'm sorry. I wasn't aware of that. Okay, great. Now, I know that Witham operates clinics in several nearby towns and cities. I think Crawfordsville, Frankfort, Zionsville, for example. So all those will become part of Parkview.
They will all become part of Parkview as we go through the due diligence. But I would also say after that, services are going to need to be expanded for that growing community, vibrant community, exciting. I mean,
it's remarkable. What's happening in Boone County is just so exciting, and we're excited we can come along the county with them and get to work to meet that need. But they've done just a tremendous job of creating access points. But with the growth that's happening, more access points, more people, you need more access. And so that really is part of our vision for the county. And that is a really exciting.
And I think that places like West Lafayette and Lebanon, they're growing at a rate and they're a size where they, I don't know if it's the right word to use, but deserve the higher level of specialty care that you can that Parkview can help assist in bringing to those communities.
Mm-hmm. The project in Marion. Tell me more about that.
So we have a freestanding ER urgent care, which is really an exciting model that we did in southwest part of Fort Wayne. So this will be our first non-Allen County ER urgent care where patients, I can't tell you how many times I get phone calls and get asked, should I go to the ER? Should I go to urgent care? True story. My wife told me that she was going to take one of our kids to the walk-in clinic. I said, well, take her to Southwest. They've got an urgent care. She goes, she doesn't need the ER. Why are you telling me to go to the ER? That's ridiculous. So, I get it at home even. So we, so often it's just hard to know where's the right place to go. We try to make it easy. And in this model, as a patient, you show up based on clinical criteria. If it's emergent, based on what the physician sees, charged as an emergency patient, it's an urgent care. Or if it's based on clinical criteria, if it's not emergent, you're charged as an urgent care visit. And it's the same physician that's seeing you both ways. So we're trying to make it easy for folks. And so we have that model in Marion. We'll have a medical office building with specialists, primary care, where they're going to come into the community to see patients. So again, you don't have to drive to Fort Wayne or Central Indiana for care. You can receive most of your care there. And then we also have some other primary care practices, planning an ASC, which is really exciting. So really trying to provide a lot of good, easy access points in there. Thing you would add, Greg?
And the goal is to keep as many patients local as we can keep local. Now, you can't do everything. You're not going to necessarily do bypass surgeries and those sorts of things, but really focusing on, can we deliver this service so someone can get their care locally and stay locally? Most patients want to stay local. And I think if we can do that again with the Parkview safety and quality and service excellence, I think everybody wins.
Mm-hmm. I'm sorry, is the bigger Marion facility, is that completed or that is?
No, that was groundbreaking.
Beginning of
the summer.
Okay, yeah. Right. So what's the timeline for that one?
It's about a year and a half.
Okay. And then includes the office building. Gotcha. Okay. And then tell me about the arrangement with Riverview Health. This could be entirely beyond my keen, but let's try it.
This is the relationship with Riverview has been such a blessing. The leadership of Hamilton County is absolutely incredible. Their vision, their support of their local hospital, and truly caring for their community is something that for me has just been just a blessing over the past year.
Yeah, when you have the county leaders, wanting to assure that the co-workers of Riverview, that the providers, the physicians, the nurses, the nurse practitioners, they are, I wish all of Riverview's co-workers could see the dedication of the county leaders and commissioners to Riverview Health. And I think that's what John's alluding to.
Again, you talk about the alignment of culture.
Yes.
And our culture is caring for people. That aligns perfectly with the county and their vision. And so it's been, again, I use the word blessing intentionally. It has been a blessing to get to partner with them. The arrangement is set up to where Riverview is a completely independent hospital. It's county owned. You have 7 voting board members who are named by the county commissioners. They're all there in Hamilton County. The CEO and some members of the leadership team are employed through Parkview, but the board has the final say on who the CEO is, and all the final governance flows through the board. So it acts as a wholly independent facility. We as Parkview are here to provide our resources and expertise to help that facility be successful. It started with partnering around Epic, which is our clinical documentation system. But as the needs began to evolve and emerge, the conversation of how can the relationship form and how can we help you? Again, we always think about from the community standpoint, how can we support the community in the way that they need? And this management agreement is really where that came about. Anything you would add?
Yeah, I would also say that the management agreement is not your typical management agreement in that if and when Riverview is successful, Parkview is successful, and if Riverview is not successful, Parkview will not be successful in that venture. So you have alignment of incentives. And it's not just, you pay us to manage your facility and we'll bill you for that. And, good luck. We really have, skin in the game with them, which again, when you begin aligning incentives, good things happen.
So often relationships fall apart when those incentives are misaligned.
Mm-hmm.
And you see that in healthcare way too often. And that's what I love about the relationship is that the incentives are wholly aligned to where we're working towards the same goal.
One more question. So when you open in West Lafayette in June 2028, what are the benchmarks? How do you know whether or not you're doing a good job?
So from a quality perspective, we have standards and benchmarks that whether it's a length of stay, whether it's time to balloon for somebody who presents with a heart attack or a myocardial infarction. So we're not lowering our standards for all of the various metrics. One that others measure us by, but we also have a lot of measures that we measure ourselves by that we think are as and sometimes more important than some of the public reported stuff. So we the metrics are already there. So it's not about developing new metrics. When somebody presents to the emergency room, how long before they see the physician? Those are pretty standard metrics. So it's not about in coming up with the new metrics. It's about meeting the targets that we set. And what we set our targets very aggressively. We want to be in the top 10% of whatever we do.
Mm-hmm. Top 10% of all hospitals.
All
in the
country.
Okay.
I would say, so we have objective data that we have benchmarks we're always going to look at. The thing that I'll be really paying close attention to is that patient experience and feedback. So you receive data, but you also see the comments. One of the things both Dr. Johnson and I like to do is talk to patients, talk to coworkers, and see, and just you feel it when you're talking to folks. So to me, there's the data, but then there's just the feel. We've got this vision we're working towards. So as people begin to come in, you feel it, and that's the other piece I'll be looking at.
And I would add, having opened a couple different facilities, generally you have such a emotional high. The opening's not the big thing. It's when you start getting your legs underneath you, and now now we're into more of the routine, kind of the pomp and circumstance of opening a new facility is gone. So we spend a lot of attention, not just at opening, but as we go in 365 days a year ad infinitum.
It's usually that month 3 to month 4 is where you kind of hit that emotional wall. And so how do you sustain it? How do you build a
And really, when you do open facilities like this, it isn't without any issues. I mean, you're going to have issues arise, and the question is how well do you manage those issues? Mm-hmm. And that's, we spend a lot of time, one, allowing our coworkers to fix things. They don't, we want to be nimble. It isn't about, the nurse has to go to her manager, who has to go to the director, who has to go to et cetera, to fix something that is a just do it. And so we know there'll be issues anytime you open a new facility. But really it's one of our secret star sauce is allowing coworkers to, again, have that voice, listening, so leaders are listening, to allow our frontline coworkers to be wildly successful, not just successful, but to be wildly successful in the delivery of care.
I really appreciate you guys taking the time. I know you're very busy. Thank you so much for coming down to the studio.
Thank you. This was wonderful.
Yeah, it's our pleasure. Anytime you'd like to have a discussion about Parkview, we'll be here.
My thanks again to Dr. Craig Johnson and John Bowen. And folks, before you get on with the rest of your week, there are several stories in this week's issue of IBJ I want to draw to your attention. First up, the federal push to expand broadband access to rural areas recently has taken some head-spinning turns related to the participation of Elon Musk's firm Starlink. Greg Weaver reports on the latest developments in Indiana. Also in this week's issue, Dave Lindquist details the more than $10 million in grants awarded to Indy area arts and culture organizations through the state's Ready 2.0 initiative. And Daniel Bradley lays out the economic case for Butler University's new Bachelor's of Science degree in respiratory therapy. And again, you can find these stories and features in the latest print edition of IBJ, or of course online at ibj.com. I will say it is quite a bit easier to access all the latest business news and all of IBJ's data on Central Indiana's business community and economy if you're a subscriber. We're running a promotion right now that gives you complete access for $1 per week for 3 months, just to get a sense of how valuable and original our content is. Just go to ibj.com and click on the subscribe button. And thanks again for making time this week for the IBJ podcast. I'm Mason King. Hang in there, everybody. We'll be back again next week.